Hello and welcome to the Greater Wisconsin Agency on Aging Resources webinar on Title III-D, Disease Prevention and Health Promotion Requirements of the Older Americans Act. My name is Angie Sullivan and I am the Older Americans Act Health Promotion Consultant for GWAR. I provide technical assistance for 70 counties and 11 tribes in the area of health promotion. Today I would like to give you an overview of Title III-D. I will discuss service provisions and priorities, allowable versus non-allowable expenses, reporting guidelines, and how to find health promotion workshops that are high-level evidence-based. So let's get started. This slide gives us a visual of the structure of the aging network from the federal to local level. At the federal level, the Administration on Aging receives Older American Act funds and allocates them to states. At the state level, the Division of Public Health, Bureau of Aging and Disability Resources, then receives the Older American Act funds and distributes those to each local aging unit. GWAR is the area agency on aging that oversees the Older American Act funds in 70 counties and 11 tribes. This slide offers another visual of the flow of Older American Act funds. In Wisconsin, the funds go to the Bureau of Aging and Disability Resources, and you can see those funds are distributed to 3 area agencies on aging in Wisconsin: Dane County Area Agency on Aging, Milwaukee County Area Agency on Aging, and then GWAR. We oversee 70 counties and 11 tribes. You can see the Aging and Disability Resources bubble on the left-hand side. Several of our aging units are integrated with their Aging and Disability Resource Center. At GWAR, our mission is to deliver innovative programming, support lead agencies at the local level as we work together to promote, protect, and enhance the well-being of older people in Wisconsin. At GWAR, we provide training, technical assistance, advocacy, quality assurance and improvement, and assistance with managing the Older American Act funds. This slide shows the 2020 discretionary appropriations. Notice the red arrow, which points to the Title III-D health promotion dollars. You can see that health promotion is 1.2% of the overall Title III funds that go to the local aging units. These healthy aging dollars illustrates that the intent of Title III dollars are meant to be seed money. It's important for local agencies to partner with health systems, public health departments, extension offices, university for the sustainability of programming. You may be asking, how can Older Americans Act Title III-D grantees afford to implement evidence-based programs given that limited funding? Partnerships and collaboration can extend the reach of those health promotion dollars. Many aging units tribes use 3D funding to leverage other funds. It's common practice to blend funding streams to fund different components of the same activity to make a complete program. Depending on the health promotion program, funding sources may include public health departments, hospitals, foundation giving, cities and park recreation departments, etc. In this slide, you can see on the left-hand side in 2020, we had the CARES Act COVID-19 response, which increased funding to our local aging units. A lot of our local aging units were taxed with increased in-home delivered meals and other resources to be able to respond to COVID-19. So we do see an increase in funding in 2020. We'll see American Rescue Plan's funding as well, so those numbers will increase. Title III Part D of the Older Americans Act was established in 1987. It provides grants to states for programs that support healthy lifestyles and healthy behaviors. Evidence-based disease prevention and health promotion programs reduce the need for more costly medical interventions. Priority is given to serving older adults living in medically underserved areas and those who are of greatest economic need. Effective October 1st, 2016, in the reauthorization of the Older Americans Act, health promotion and disease prevention programs must be high-level evidence-based to receive Title IIID funding. Reviewing the Older Americans Act service provisions and priorities, which stand true for all Title III programs. Older American Act funds serve anyone 60 and older. They pay attention to low income, minority, older people in rural areas. There is no income or asset test to participate. However, participants must be provided the opportunity to make a voluntary contribution, but they cannot be charged a fee. So what are evidence-based programs? Evidence-based programs are theory-based. They have a strong evidence of effectiveness from research, and they have measurable outcomes. Evidence-based programs are replicable across the state. You're able to take a Stepping On program in Rock County, and it will be the same curriculum that you would have in Ashland County. There must also be a protocol for training and technical assistance, participant materials, leader materials, quality improvement and fidelity, and a way to collect data and track clients. There are several advantages to offering high-level evidence-based programs. Implementing an evidence-based program is widely considered best practice strategy for community health promotion. Evidence-based programming can add value in many ways. It can positively impact the health of the program participant, which is more likely with an evidence-based programmer. Funders increasingly demand that programming be based on solid evidence. Agency leaders want to concentrate limited resources on proven programs. And program managers can concentrate their efforts on program delivery rather than program development, allowing them more time to reach a larger population and have a greater impact. Older adults are also savvy, and they want to invest their time and money in programs that have been proven to work. The demonstrated outcomes of evidence-based programs are attractive to community members and potential partners, facilitating community buy-in and the formation of partnerships, especially with healthcare and clinical partners. There are 5 criteria for high-level evidence-based programming, which have been determined by the Administration for Community Living and the National Council on Aging. The first is that it must be demonstrated through evaluation to be effective for improving the health and well-being, reducing disease, disability, and/or injury among older adults. The second criteria is that it must be proven effective with older adult population using experimental or quasi-experimental design, simply meaning there's a control group to the research. The research results must be published in a peer-reviewed journal and translated in one or more community sites. So it has been pilot tested at a local level. And the last criteria is that it includes developed dissemination products that are available to the public. So you're able to have leaders trained and participant materials available as well as support. Allowable expenses for Title IIID are the costs associated to support high-level evidence-based programming. Think of it as the cost of the program. You can use Title IIID funds to purchase program supplies such as books, DVDs, display materials, and there's also other allowable expenses including facilitator staff time, stipend for volunteer facilitators, marketing materials, creation of flyers, as well as the facilitator training costs, the cost of training, mileage, hotel. Please refer to the Frequently Asked Questions document on our GWAR website under Health Promotion for more examples of allowable expenses. Non-allowable expenses is the cost of doing a program for non-evidence-based health promotion programming, such as blood pressure screenings, health fairs. Also, incentive items, if they're not part of the implementation toolkit curriculum. An example is if you'd like to provide night lights for the fall prevention or stepping on program. It does not indicate in the leader manual that you will need to distribute those to participants. However, it does say that you must distribute an ankle weight. Therefore, the ankle weights you're able to use Title III dollars, but not the night lights. Anything additional we would make the suggestion to reach out to local businesses and look for donations. Also, refreshments and food. If you are offering refreshments or food utilizing $3 it must be indicated in the manual. For example, in stepping on, there is a break halfway through the class, and it does say in the leader's manual to serve a healthy snack. Therefore, you can use Title III dollars for that program. However, make sure that each program, it does say that in the leader's manual. There are also other funding sources that can help supplement the Title III dollars. You're able to use Title III as in boy funds, as well as administrative funds for non-evidence-based programming. Also, tax levy and developing partnerships with your local business community and other local organizations. Now let's talk about reporting requirements. Even if you're not responsible for the fiscal or client data, it's important that you monitor this information. Counties submit monthly claim forms to GWAR for expenditures. In addition, counties put participant data into SAMS or WellSky database. If you are claiming Title III expenditures, you should be reporting participants in high-level evidence-based workshops. If you spend all of your Title III allocation but have no participants in SAMS, that would be cause for concern. It could be something simple like the information was entered incorrectly, perhaps on the wrong line. However, it's important that you monitor this information because it could affect future funding allocations. Title III funds should be spent in the same year that the service was provided. For example, if you spend $3 on supplies, leader training for a specific workshop, then you should be implementing that workshop within the same year. However, at GWAR we understand at times you may have expenditures near the end of the year for a leader training and actually not implement the program until the following year, which is fine. It's important to just track that information. You should know how much Title III funds your county receives. Our goal is to ensure all Title III allocations are spent in a year and that there is no carryover. My goal each year is to have 0 funds left in Title III. This money is important to be proactive in creating a healthier community for older adults. If you're in danger of not spending all your $3, please reach out to me and we can discuss several different ways that this money can be utilized within your community. How do I find high-level evidence-based programs? In Wisconsin, there are 3 main sources that you can find high-level evidence-based programs. One is to visit the Wisconsin Institute for Healthy Aging website. They offer several high-level evidence-based programs. There's also a search bar on the National Council on Aging's website where you can see programs from all across the country that are eligible for Title III dollars. And then we also have a Wisconsin Aging Unit SAMS subservice list, which provides a list of all high-level evidence-based programming that we see happening in Wisconsin, as well as non-evidence-based programming. And that can be found on GWAR's website under Technical Assistance Health Promotion. And there will be a link at the end of this PowerPoint. The PowerPoint will also be attached on the GWAR website, so you'll be able to click right to those links. So let's talk a little bit more about the Wisconsin Institute for Healthy Aging. In Wisconsin, we are very fortunate to have WIHA. It's a one-stop shop for scientifically proven self-management education programs that can bring the power of better self-care to adults throughout our state, especially older adults. As a result, that means thousands fewer trips to the emergency department or hospitalization, fewer falls, better caregiving, and measurable reductions in the progress of illnesses. They have several programs including living well with chronic conditions, living well with diabetes, living well with chronic pain, and several of those are offered in both English and Spanish. Stepping On, a fall prevention program, Powerful Tools for Caregivers, Walk with Ease, which can be a self-study program, Physical Activity for Lifelong Success, and Mind Over Matter, which is a bladder, bowel, incontinence program for women. I encourage you to go to the Wisconsin Institute for Healthy Aging website and learn more about these programs to see if they would be a good fit in your community. This slide illustrates how multiple organizations bring research to practice and ultimately to the community. The Community Academic Aging Research Network, or CAARN, brings together academic researchers and community partners to conduct clinical trials and dissemination research related to healthy aging. They bridge university and community entities to increase research, provide training, venues for networking, resources, etc. CAARN facilitates research by pairing community partners and researchers to take the intervention from conception through stages of research to demonstrate its effectiveness compared to a control group, so the intervention can be recognized as evidence-based. Once a program has graduated the research phase of CAARN, CAARN and WIHA will work together to develop processes and materials for product dissemination and implementation. The first cohort of leaders are certified and pilot the materials. WIHA then refines materials based on feedback, and then the first master trainer is trained. WIHA then adds the programs to their cohort. Recently added were the PALS program and Mind Over Matter. WIHA licenses the programs to others and provides training, technical assistance, and support to its large network of program providers. GWAR and our local aging units and ADRCs are program provider organizations and often assist in the research phase. WIHA regularly provides updates to the aging network through our quarterly health promotion webinar. There are additional evidence-based programs that we see throughout the state being utilized. I'll just highlight a few that we have really in the last few years that have gotten a strong following within the local aging and disability network. The first being Strong Bodies, which was formerly known as Strong Women, which is a strength, balance, and flexibility program, 12 weeks long, twice a week, that is administered by the University of Wisconsin Division of the Extension. We also see several Tai Chi programs across the state. And then the Eat Smart, Move More, Weigh Less is a 15-week healthy eating program through the North Carolina State University. Bingo Size, which is aimed to increase health knowledge, as well as the Aging Mastery program, which provides resources for those entering another phase of their life so they can create a plan to age well. I communicate 3D information through the GWAR Digest, which is distributed weekly. So if you are not currently part of the GWAR Digest email listserv, please send me an email. My contact information is at the end, and I will make sure you get on that list. I also do quarterly health promotion webinars where I'll highlight different programs that may be newly added to the high-level evidence-based list. I also will invite speakers to talk about health equity and other topics that are of interest to the Aging Network. In addition, WIHA has office hours where They regularly get together with program providers for their health promotion programs. Here's a list of several resources that I thought would be helpful. The first is a website for GWAR. As I mentioned, there are health promotion and other important resources under technical assistance. You will find those listed. WIHA's website, it would be wonderful if you could take a few minutes and go through their website. It's very well organized and has videos that will give you a summary of their programs. Administration for Community Living provides a lot of great information on the Older Americans Act itself. National Council on Aging, in addition to providing that search bar for high-level evidence-based programs, they also have other really pertinent information. And the county health rankings and roadmaps when you are looking for local data on health conditions. I want to thank you for taking a few minutes out of your day to watch this webinar on Title III-D. My contact information is listed. Please don't hesitate to give me a call or send me an email if you have any questions. Thank you and have a great day.